General teaching approaches. Medical and preventive education. Sanitary and hygienic needs of the child. Forming body hygiene skills, especially relative to oral cavity and genitals. The timeliness and optimal frequency of aesthetic and hygienic procedures are always specific to an individual. For one child with dry skin, washing their body with a washcloth may be enough once a week. For another one, it may be twice a week. The same is true about nail trimming and visiting a hairdresser. To promote a feeling of comfort from wearing clean and neat clothes and shoes, as well as from an adequate sanitary condition of the child's environment, which means that the child will develop an aversion to dirt, dust, and disarray in general. Hygiene rules and environmental health control are the first steps to disease prevention. First, tooth decay. 2. Gynecological, venereological, and urological excesses. 3. Skin allergies and dermatosis. 4. Worms. 5. Lice. 6. Intestinal disorders. 7. Nervous disorders. For example, you can't sit on something too cold. You can't drink something too cold. Types of teratogenic and pathogenic effects on a child's psychophysiological health. Active threats include: first, emotionally negative impact on the child's psyche by parents, peers, or certain kinds of social events. 2. Infliction of physical injury by parents or social environment. 3. Sexual incidents. A child's premature, early onset of sexual activity contributes to delayed physical development. The child may not grow tall and have an asthenic body complexion, a major fear in boys. In girls, there's a risk of premature pregnancy, giving birth to a child with birth defects, or having pathogenic effects after pregnancy termination. Vaginal and anal injuries. Risk of venereal diseases. Premature experience of frequent chaotic orgasms is a prerequisite for future drug addiction or alcohol. Psychologically speaking, the signs are scattered attention, instability of attention, and as a rule, when the child becomes an adult, they won't be able to complete any task. They might be lazy and apathetic towards life. There's a risk that the child will join a criminal group. Passive threats include